About COVID-positive symptomatic legacy employees caring for patients pushed me over the edge. Further compounded with the staffing shortage, now immunocompromised folks may have to have COVID-positive symptomatic people caring for them. Terry, thank you so much for reaching out. If you missed our coverage earlier this week, Terry's talking about Legacy Health's policy to let employees at their hospital who test positive for COVID come back to work after 5 days of isolation, even if they still have symptoms. Those symptoms just have to be mild enough to be controlled by over-the-counter meds. And the hospital's chief medical officer told us the staffing shortage right now is so bad, they frankly have no choice.
So if you are a pregnant person having a baby, if you're in a traumatic accident and need care, if you have cancer and are undergoing chemotherapy, we have such an issue right now between COVID taking our people out of the workforce in healthcare and a national staffing shortage. So those two things combined, we now have fewer resources to treat more people. And the question is, how are we going to do this as a nation in healthcare?
All right, so he stressed safety is the hospital's top priority, and he added staff are vaccinated, they're wearing personal protective equipment, and they're following CDC guidelines. That being said, we had a lot of people writing in with reactions similar to Terry's. They were just blown away by this. So we decided to broaden this question out, and we reached out to other local hospitals to ask them, are they also letting staff with mild COVID symptoms come back 5 days after testing positive? Again, Legacy is, but we also asked OHSU, Providence, and Kaiser Permanente. We'll go one by one. First up, OHSU. They responded quickly and they were blunt. No. A spokesperson wrote, if an OHSU workforce member tests positive for COVID-19, they must isolate for 5 days. After the 5-day isolation period, the workforce member must take a rapid antigen COVID-19 test. If the test is negative, they may return to work. If the test detects a positive case, the workforce member must remain in isolation and not return to work for a total of 10 days. So that's OHSU. Up next, Providence. Their spokesperson also got back to us really quickly with an answer basically similar to OHSU's. Caregivers, they wrote, must isolate for 5 days from first symptoms or from their first testing date if they don't have symptoms. They will then get a second test for clearance to return to work. And the same story here. If that second test is positive, you will wait to return to work until day 11 after your first symptoms. So again, depends on the test. They cannot come back with those symptoms without testing. Finally, Kaiser Permanente. And unlike the last two examples, a spokesperson for Kaiser says they have gone the Legacy route. Here was their statement, quote, Kaiser Permanente is following the CDC's most recent guidelines on healthcare workers / contingency status, which say healthcare workers with asymptomatic or improving symptomatic infection can return to work 5 days after onset of symptoms, or if asymptomatic, the date of the positive test. Also, they wrote no fever for 24 hours. Okay, so here is the final count. Legacy and Kaiser are letting employees who tested positive come back to work 5 days later, even if they have mild symptoms. OHSU and Providence are not. They make employees test again, and if they're positive, they have to isolate for 5 more days. Let us know what you think of this.